Joining us live now for Medical Monday, Dr. Wilkins from BayCare Clinic. We are talking about something that impacts so many people around the country, back pain.
Yes.
So tell us a little bit about what it is, who suffers from it, and why.
Well, great questions. Back pain, first and foremost, is one of the top 2 reasons why physicians see patients across the United States. It rivals cardiac disease between the number 1 and the number 2 reason people seek medical care. Far too often, however, patients are given a myth that their back pain isn't serious, it'll just get better, it'll just go away. The problem is pain is a symptom, and it's as a symptom that doesn't actually explain the cause. And there are so many different causes to back pain that are insidious, that really are underlying the problem, that people shouldn't just brush it under the rug.
So for people who do have back pain, what would you say would be the most common thing that's causing it, that a lot of people are doing or not doing correctly?
Sure. The most common cause is what we call biomechanical back pain. First and foremost, there are 2 categories of pain, if I can call them categories.
Yeah.
The first one would be pathologic pain. Those are the obvious ones. Somebody bends over, herniates a disc.
Yep.
They get a fracture in the spine. They get a muscle tear, tendon disruption, something along those lines. Mechanical pain is doing something that you shouldn't be doing that causes stress and strain across joints or muscles or tendons. And you look at it on an MRI, you look at it on an X-ray, the studies might look normal to you. However, you're still in pain.
Right.
So you may get those studies, somebody tells you, gives you information that says, you're okay, there's nothing wrong with you. But the problem is the patients know that they're still in pain.
Right.
And what am I to do? Because someone's got to believe me.
Absolutely.
So really the number 1 reason that people have issues is biomechanics, and that's not as obvious to detect unless you see somebody who's kind of trained to actually go through an examination and figure out what it is that's causing it.
Right, so they're doing something wrong and you just can't see it.
Correct.
All right, perfect. We also have some symptoms of things that you should be aware of that are not just back pain. We have a full screen here graphic, if we can pull that out. Back pain, the things that you cannot ignore. So can you tell us a little bit about these and why you shouldn't ignore them when you see them with back pain?
Yes. Like I said, back pain is merely a symptom of something underlying. So if you have a fever, unexplained weight loss, swelling in the affected area, chest pain, loss of bowel or bladder control, basically incontinence, those are all signs or symptoms of something greater that may not simply be a problem with the back, but there may be something with the other organs of the body that need to be checked out.
All right, and the back pain is just kind of a factor leading up to that.
Correct.
All right, perfect. What things can we do to avoid this? I read somewhere like sleeping on a firm mattress. What things can we do, just regular everyday people?
Sure. Everyday people can, for the most part, just be conscious of how they move. Maintain a healthy diet and weight, warm up or stretch before exercising, maintain proper posture. Like you said, sleeping on a medium to firm mattress, lifting with your knees. What you really want to try to do with that lifting with your knees is avoid the combination of bending and twisting together.
Right.
That exponentially puts torque across the spine, and that's where people herniate discs.
Do you think a lot of these things are people that they don't even know that they're doing it, right?
Oh, absolutely. They've done it this way since they were kids. You know, we've been fine as teenagers, as young adults. All of a sudden, something happens where we just move the wrong way. There's just enough force. Maybe you had a bad night's sleep and your muscle was a little stiffer than it was the night before, and you bend over to put on your sock and you herniate a disc. I've seen that happen.
That's what happens when we get older, right?
It does. It does happen as we age, but it can happen at any age too. So we shouldn't just take our youth for granted either.
All right, be aware of those symptoms. All right, thanks, Doc. We appreciate it. For more information about back pain and what you can do to help it, just visit our website and click on the Wisconsin Tonight tab. We have lots more information.